So before I introduce our speaker today, I wanted to give you some context for the theme, Inspire Hope. As some of you know, the Samaritan Foundations in Albany, Corvallis, Lebanon, Lincoln City, and Newport launched our first ever system-wide comprehensive campaign in 2021. It's a $35 million campaign over 5 years called Stronger Together, and it features local and regional initiatives. The campaign theme, Stronger Together, illustrates the collective impact that donors to the 5 foundations are making in support of Samaritan's mission. The campaign theme, Stronger Together, illustrates the collective impact that donors to the 5 foundations are having in support of Samaritan's mission, building healthier communities together. Stronger Together's framework consists of 4 themes. These themes build upon past successes, highlight organizational and community pride points, embody our shared values, and represent a vision for the health and well-being of our entire region. This framework holds the projects, programs, and initiatives that our local stakeholders have identified as top priorities, which are listed here, and to ensure the highest quality healthcare for patients, and also to address social determinants of health for people living in Benton, Lincoln, and Lynn counties. So first, we have improved access. That's improved access to care through enhanced services and technology, particularly in our rural settings. Next, Inspire Hope by supporting patients to help ensure everyone gets the care that they need. We offer innovative approaches to enhanced behavioral health services, like the program we're going to be talking about today. We build community through early interventions, expanded care for vulnerable patients in and outside of clinical settings, and collaborative approaches to address complex community health needs. And finally, we extend opportunities for local donors to leave a legacy of generosity by inviting support that will impact the future of healthcare through scholarships, endowments, and research endeavors. So now let's dive in and learn more about inspiring hope through Samaritan Treatment and Recovery Services, affectionately known as STARS. The current STARS facility is located in the Barbara and Larry Mullins Center in Lebanon. And I know that Dr. Mullins had signed up for this program. I'm not seeing his name on the side, but if you are there, thank you so much, Dr. Mullins, for joining us. Our speaker today is Lamont Morgan, the STARS director. Lamont has been dedicated to providing substance use disorder treatment services for the past 15 years and has held numerous positions in the substance use disorder field, including peer support specialist, alcohol and drug specialist, outpatient counselor, residential counselor, and transitional housing program director. In addition to directing the program in Lebanon, Lamont will also direct the STARS program we're creating in Lincoln County, and you'll hear more about that during today's presentation. I did put my email address and the link to our website in the chat, just in case you'd like to know more about what's happening here on the coast. You can contact me after the program. And now I will turn the floor over to Lamont to share why he is passionate about the work that he does and to tell us more about the services offered through STARS.
Thank you, Ursula. Yeah, so my name is Lamont Morgan, and like Ursula said, I've been in the field now for 15 years, held numerous different positions in the field. I came into this work because I also identify as a person in long-term recovery. And my passion for this work was created by when I needed the help, when I needed treatment, there was someone in the seat that I occupy now that provided me the services, the assistance, the help that I needed. And I want to be that person for someone else, right? To encourage them that there is hope and that we can and we do change. I'll talk probably a little bit today about stigma and trying to avoid some of that, but primarily my discussion today is going to be focused more around what the services are at Samaritan Treatment and Recovery and what our staff's dedication and passion is to providing the much needed treatment services to our communities. So I'm going to attempt to share my screen. Sometimes this works for me really well and sometimes not so much. So I'm hoping everyone can see that.
Yes, we can.
Perfect. All right. So, Samaritan Treatment Recovery Services, just to kind of give a brief history, we started in 2017 from a different location, and we were only providing outpatient services at that time. We moved into the current building that we occupy, brand new building that was built for treatment and recovery in April of 2020 and started providing residential services in August of 2020. Yes, we know, right in the middle of the pandemic, right? Looking back on it, maybe not the best time to start a new program, but we did it and we're still here. We did have to do a brief pause for residential for a little while, pandemic concerns, staffing concerns, etc. But we only had to take a 3-month break and we're able to get started again. So, all right, so we'll just move through this and maybe if I can make it move forward. There we go. So our mission here at STARS is that we believe there's hope for recovery from substance use, should say use, not abuse. Sorry about that. The wording's changed to be more, reduce the stigma, to help reduce the stigma. So substance use disorder. We have a patient-centered treatment approach to promote a recovery management model. And with that, we believe people get better in a healing environment if it's fostered with dignity, compassion, and respect. So all the staff here at STARS strive to do our best to treat every single patient regardless of age, sex, gender identity, religion, all of that stuff. They are the most important. They deserve to be treated with dignity, compassion, and respect. We're committed to working with other client-centered and evidence-based recovery programs in our communities to create a recovery-oriented system of care for the whole community. So it's not us against them. It's a community effort, right? You talk about the old saying that my grandfather used to say a lot, it takes a village to raise a child. It takes a whole community to provide the support and the services to people that are struggling with substance use disorders. We also believe that we're better as a community team than a group of non-connected individual entities. We don't want to be an island unto ourselves. We want to be part of the solution, not part of the problem. And that we are committed to continuous improvement and growth as we are striving to improve the physical, spiritual, and emotional health of our patients. So even though we may be doing something really, really well, we are still dedicated and committed to what are the ways we can improve? What's the new evidence-based or the new programs and curriculums and stuff? We're constantly looking at all those and hoping that we're able to stay on the front line of all of the new stuff to provide the best quality care that we can to our patients. So a little bit about our vision and values. Pride. The Samaritan Pride statement, right? That's our vision here at STARS too, is to serve our community with passion, respect, integrity, dedication, and excellence. So the Pride statement, as it relates to us for passion, we believe 100% in our purpose and calling to serve our patients, coworkers, and community with the best that we have to give. I am really fortunate to direct a staff that is absolutely true, that we believe in our purpose and our calling, and that we strive every day to give the best that we have. For respect, we believe all people deserve to be treated with dignity and courtesy, whether it's a patient, a coworker, a colleague, somebody we just pass on the street. Like, we are striving to treat everyone that way. For the integrity piece here at STARS, we believe in doing the right thing, not only for our patients, but for our coworkers, the organization, and our communities. Dedication, we believe we all have the authority and responsibility to do whatever possible to achieve our vision. So here at STARS, all of us, we believe that we have the responsibility and the authority to do what is it that we need to do to make it possible so that we can achieve our vision for quality substance use disorder treatment. And excellence, we just want to continue to consistently provide the best services and programs to our patients. We use best practices. We evaluate our programs constantly to ensure quality. We evaluate our documentation, consistently. We just want to make sure that we are meeting that mark of excellence. So what do we offer at STARS? Co-occurring capable substance use disorder treatment services, both in the inpatient, residential, and outpatient setting. We are not a co-occurring treatment center ourselves here, but we have the capability to provide the substance use disorder treatment, and in partnership with our community members, offer mental health and co-occurring services as well. So we do really good job of, if there's a mental health concern as well while they're here in treatment, we get them connected with a mental health provider, mental health therapist, and we make sure that they have the freedom and the time while they're here with us to attend both of those. Our continuum of care serves patients needing a higher level of care, which is inpatient and intensive outpatient, as well as the lower level of care with the outpatient services and our DUI education groups. Specific interventions also, so we have the medication assisted treatment clinic not far from us, and so if they are if they come in and they are struggling with opioid use disorder, sorry, I'm speaking faster than my brain's working right now. If they struggle with opioid use disorders, we can connect them with the recovery clinic and get them the medication, Suboxone, Subutex. We're working on the Vivitrol injections as well. We finally got some approval for that. So making sure they have everything they need to set them up for success. Access to our services. Here at STARS, we realize the window for intervening with the person who struggles from substance use disorder most of the time is really, really narrow and very time sensitive. So we do everything that we possibly can to take advantage of that window of opportunity and get them into services as soon as possible. Sometimes it's not the individual reaching out, it's their family members or someone they care about. And we always try to remember and focus on, this is probably the most chaotic, unpredictable, and frightening time for not only the person struggling with substance use, but their family members and the people who care about them as well. With that mindset, it's our program and our staff's commitment to assist in removing any obstacles and barriers for the patient to receive the services they need. There's enough stigma and enough barriers out there in the community already that as a program, we don't want to create more obstacles. We want to remove as many as possible and get them the help and the services that they need. First steps to getting connected with us, it's our belief there's no wrong door to treatment, whether it's a referral from a family member, another professional or stakeholder, or the patient themselves. There's no wrong door to enter treatment. After a referral is made, our staff responds promptly. We complete a phone screening, set up an appointment for a full ASAM assessment. We do our best to connect them with peer support, whether it's a Samaritan Treatment Recovery peer support or Family Tree Relief Nursery or community partner peer support. We connect them with our care coordinator to start some case management.
All right, so let's try this again. So I think first steps is where I left off when we had the issue start. So here at Samaritan Treatment Recovery Services, it's our belief there's no wrong door to getting into treatment, right? That entry into treatment, there's no wrong way for a patient to get to us. Whether they're self-referred, referred by a family member or another professional stakeholder, sometimes it's their PCP, sometimes it's the ER or the ED departments, whatever it's from. So after we receive a referral, our staff responds promptly, schedule an appointment for a full-on ASAM assessment. We do a phone screening with the patient as well. We offer peer support, whether that's with a Samaritan Treatment and Recovery employee peer support or one of our partner agencies to get, immediate peer support as much as we possibly can. And we connect them from the beginning with our care coordinator to start any case management or referral services that the patient may need. So the full-on ASAM assessment, we use the 6-dimension ASAM approved assessment model to determine the appropriate level of care. And this tool gathers information from 6 different life area dimensions. Dimension 1, acute intoxication and or withdrawal level. So, are they still actively using? Have they not been actively using for a period of time and are at risk of withdrawal? We want to know what they're using, how much they may be using, and what their withdrawal level is so we can keep them safe as they enter services with us. Biomedical conditions or complications, we want to make sure that if there are any health concerns that, as staff, we're aware of them, we're connecting them with our medical team and our medical director if they're coming into residential, if they're in our outpatient or intensive outpatient, are they connected with their primary care, or do they need help setting up a primary care? So we're making sure we're taking care of all of those as well. We take a look for Dimension 3 at the emotional, behavioral, and cognitive conditions or complications. Sometimes addicts that have been actively using and people struggling with substance use disorder, maybe they haven't attended, maybe they dropped out of school at a young age and they struggle with some literacy issues. We want to make sure that we're treating them fairly and connecting them with supports as they need those things. Do they need an appointment for medications? We look at what is their level for readiness to change so that we know as we're bringing them in and our staff starts to work with them, we can meet them at that level of change and help increase that. Dimension 5, what's their relapse, continued use, or continued problem potential? Especially for those that have maybe ceased their substance use for a short period of time. What's the Dimension 5 and 6 kind of go hand in hand, the recovery environment and the relapse potential, right? So are they living in an area to where use is actively happening either in the home or close to the home? Does that impact their relapse potential? So we gather information on all 6 of those dimensions, and then we take a look at, okay, so where do they fit? Is it outpatient? Is it intensive outpatient, or do they meet the criteria to enter our residential program? So description of services. So the services we provide actively here in Lebanon right now are group counseling, psychoeducational groups, mindfulness-based cognitive behavioral therapy groups, interpersonal process groups, individual therapy, skills development, peer support services. For our residential program, we have the therapeutic milieu staff, care coordination and case management with our care coordinator. We set them up for success for continuity of care, not only while they're here, but as they transition from treatment back into their community, what's the continued care that they may need. And we also, again, like I said earlier, have the medication-assisted recovery program. So I'm just going to go through some of these quickly. I'm not going to get into a whole bunch of detail about them, but just so you give you all kind of just a brief introduction. So for group counseling, group therapy is a preferred modality in treatment for many reasons. It provides a forum for them to practice the recovery skills that they're learning in group and to receive feedback from their peers as well as their counselors. Feedback from their peers is much more impactful because they get like real time, some of their peers are struggling with the same things and they get that feedback. And this type of peer support is vital to recovery, helps reduce the stigma. And, when you graduate from treatment or complete treatment, peer support, 12-step programs are peer support, right? So it sets up the foundation for, as they're moving forward, hopefully they have an introduction to how peer support is vital. The psychoeducational groups, to provide patients with info regarding substance use and related issues. For these groups, could be a lecture format from the counselor, could use CDs, DVDs, podcasts, YouTube videos, written material, to just really introduce to them more of the educational piece than the peer support skill building piece. So our education groups in our residential treatment program, we do educational groups ranging from topics like good nutrition, how to create a budget, radical acceptance, just a whole slew of different things that aren't necessarily drug, substance use related, but life related. For the DUI education group, it's primarily a psychoeducational group, but that's offered to people that have received a DUI. They go to court, they get an ATIS, they get referred to us. And the education that is offered for those includes, but not limited to, the things that the courts really want to make sure that we cover with those patients is history, use, and definition of alcohol. You know, what's the history, what's it been used for over history, and what's the definition, the physiological effects of alcohol, some education around other drugs, whether they're legal or illegal, and how those substances affect driving, whether used separately or in combination with alcohol. The psychological and sociological consequences of abuse of alcohol or other drugs and how it affects their families. How blood alcohol level content can affect driving performance. What are some of the court penalties if you have, it's your first DUI, your second DUI, your third DUI. We talk about alcoholism both as a problem and as a disease, and we offer up alternatives to drinking and driving. So, all of the patients who come in with DUIs aren't necessarily never going to drink again, and that's not truly their goal. So we give them, education around, so if you choose to drink again, what are you going to do to avoid drinking and driving? The mindfulness-based cognitive behavioral therapy groups, that's more to change learned behaviors by changing our thinking patterns, beliefs, and perceptions. Right? Our behavior is directly linked to our thoughts, our beliefs, and our perceptions. While these groups are beneficial to many, they best serve these following populations. Patients that are involved with the criminal justice system, under supervision of parole and probation, participating in treatment court programs. If we have a patient who comes in and myself and my clinical supervisor see some thinking patterns, behaviors, or risk factors, we have a discussion and say, maybe CBT is a good approach for them, and then we'll connect those patients with that as well. The services and supports include the following interventions. Cognitive behavioral interventions, what's our thought process around it? How do we motivate people to make a change, right? Doing that motivation enhancement. Let's get you motivated. Let's get you to the point where you understand and see that you may need to make a change. We talk about relapse prevention and recidivism for those involved in the criminal justice system. And we give them some education on either repairing broken or strained relationships or just how to have healthier relationships. There are gender-specific interventions for that, and when we offer those up, that is taking into account that sometimes a patient who may identify as female, that their pathways to crime are much different than their male peers. Support groups, while we don't offer support groups specifically here at our site, they're an adjunct to treatment and an important part of ongoing recovery. So while the best known support groups out there are 12-step, Narcotics Anonymous, Alcoholics Anonymous, Marijuana Anonymous, etc., there's also other avenues to find support. So what we do really well, in my opinion, as a staff is we sit down with the patient and we're like, okay, so where are you going to find your support? Some patients tell us NAAA 12-step isn't for me. Okay, great. Well, what is, right? Can we connect you with Dharma Recovery, Red Road to Sobriety, whole slew of other options. And then we sit down with the patient and say, like, okay, so if this is the one that works best for you, we want you to check out a few of these meetings while you're in treatment, and then report back to us what was your experience like, and if it's not working, let's find something that's going to work for you to continue to provide you the support that you may need when you complete treatment. And the medication-assisted recovery, our staff's trained to assess and refer patients to one of our providers for an evaluation for medication, right? So I'm not a doctor, and I don't even get to play one on TV. So if I'm meeting with a patient and I identify they have opioid use disorder or there's some other reason why, I think I need to send Ursula over to the recovery clinic so she can just get an evaluation to see maybe medication-assisted treatment and recovery is going to help her with cravings, withdrawals, all of those things. And, that has proven to lower, decrease the mortality rates and increase the engagement and retention in treatment. So we work really, really well with our partners down at the recovery clinic. So our philosophy for treatment here at STARS, we don't want to say stole, but we adapted them and used the SAMHSA 10 guiding principles of recovery. So the first one is that recovery emerges from hope, right? And so we like that one because the way that it's kind of explained is that addiction leaves everyone feeling hopeless, whether it's the person who's struggling with the addiction, their family, maybe their employer, the community, right? It leaves all of us feeling hopeless, and that recovery can emerge from just providing a little bit of hope to that patient. We believe the second guiding principle from SAMHSA is that recovery is person-driven. So we believe that the days of telling an addicted person what's your best thinking got you so far, your best thinking's got you here, got you arrested, like that used to be the norm, but those days are over. That's not what we want to do. We believe and know that the addicted person, the person struggling, is truly the expert in their own healing. So we need to work together with them to find out what do you need? What are you hoping to gain out of treatment, right? I can sit down all day long and tell anybody, well, I think you need this, I think you need that. I'm not going to get the buy-in I need from my patient. They've been told enough from POs, parents, family members, etc., what to do. And so it's not for me to tell them this is what you need to do. It's for me to meet them where they're at, walk beside them. What do you need? What are your goals? How can I help support you? How can I get you there? And the third one, recovery occurs via many pathways. Again, we know that recovery sometimes for treatment, a lot of times one of the stigmatizing comments that I hear that I'm also dedicated to try to decrease is, you've done treatment 5 times, what's going to be different? Well, maybe the 6th time will be the time that something clicks and they get the help they need and they stay there. So, and sometimes maybe it's not 12-step, maybe it's not outpatient treatment, maybe it's not residential treatment, maybe it's something different. There's many, many different pathways that lead and guide somebody to recovery, and we want to stay focused and open to other areas of recovery for our patients. Fourth one is that recovery is holistic. It impacts every area of a patient's life and well-being. Their addiction does, and so their recovery program needs to as well, right? So if their substance use has impacted every single area of their life and well-being, for them their recovery, we need to focus on every single area of their life. Recovery supported by peers and allies. Again, part of the big reason for group therapy and why group therapy is so beneficial is the support from the peers. And, for us here as staff and as professionals, the support of our allies helps guide not only the programs to be successful, but it guides the people that are seeking recovery to be successful in their recovery. that recovery is supported through relationships and social networks, right? I don't know how many people on the call may be familiar with 12-step and support groups and support networks and stuff out there, but one of the sayings that floats around a lot that I've heard for many, many years is an addict alone is in terrible company. I have to have relationships. I can't do recovery by myself. So I have to have a support group. I have to have key people in my life, whether it's family, friends, professionals, whatever it is, whatever works for me, those social networks and those peer relationships. I need those things to keep me focused on my recovery and to continue to allow me to be successful. That it should be culturally based and influenced, right? We've got to, and I know for many years, early in my career as well, that we didn't really take into account what's the culture, right? What is their cultural identification? We have to take into account those, base their recovery on that and the influence of that. That we need to support and address their trauma, right? Recovery is supported by addressing the trauma. Again, early in my career, we focused solely on substance use disorder and would ignore the trauma. We'd ignore the mental health. And then we would see, oh, shoot, we're not having very much success in our program. What the heck's going on here? Then they would go to like a mental health program or a trauma program. And they want to focus, or they want to address the substance use disorder, and oh shoot, what's going on? Our program's not successful. What's happening here? And now the new thing is, let's address everything together, right? We got to address the trauma. We've got to address the mental health. We got to address the substance use disorder together. Number 9, recovery involves the individual, their family, and community strengths and responsibilities, right? So it's not just on the individual. The individual who's struggling with substance use disorder, yeah, they need education and they need support. Their family needs education and support, right? Nar-Anon and Al-Anon, great resources for family members to get some support on how to support their family member who may be struggling and is early in their recovery. And what are the community strengths and responsibilities, right? For different communities, it's different. Their strengths are different. Their responsibilities are, I would say their responsibilities are the same, but their strengths might be a little bit different. So we have to look at those things as well and involve all of those people. And the final one, which in my humble opinion probably should be the first one, is that recovery is based on respect, right? We have to respect the individual. We have to respect them. We don't have to agree necessarily with everything that they believe in or that they, whatever, right? But we have to respect that. Part of the biggest thing for me around stigma, and I'll just share some of my personal experience, is early in my career, I remember I would walk into meetings and kind of like this one, where I introduced myself as a person who identifies as being in long-term recovery. For me, that means I haven't used alcohol or illicit substances without a prescription for over 21 years now. Early in my career, I'd walk in and introduce myself as an addict and instantly be like, oh, he's one of those people. He's a junkie. He's a tweaker. He's an alkie. He's whatever, right? And it would just feel beat down. Like, why am I even here? Like imposter syndrome, right? I don't belong at the table. We have to reduce that stuff, right? Think about this for a minute, if you would, with me. How would you feel if the worst mistake you had ever made in your life you feel like is either tattooed on your forehead or you have to wear a t-shirt that says junkie for the rest of your life? How stigmatizing and how defeating that can be, right? So the thing that we try to focus on here at STARS to kind of help reduce that stigma and to respect each other is we're all human and we're all having this human experience and we all make mistakes. Everyone can change. Everyone has the ability to change. A strategic intervention and someone just saying, good job, I'm glad you're here, let's get you some help, may be the catalyst to create the basic foundation for this amazing change that can happen in people. So that's my brief soapbox on stigma and respect. So that is pretty much STARS, just kind of a brief, quick run through. I know I went through it really quickly. Totally open for questions. Briefly, here is just some of our quick Lebanon contact information, so the general phone number's there. Our medical director, who's Dr. David Simmons, his number is on there. My phone number and my clinical supervisor's name and phone number on there. So please feel free to reach out to us at any time. We are here to help your patients, the people that you are working with who struggle from substance use disorder. Super, super excited. I grew up in Florence, so I know that the need for treatment on the coast has been a big one for a long time. And I'm super excited to see this new Newport facility in the process, and us just being able to provide the much needed service over there, as well as here in Lebanon. So super excited for all of that. Thank you all so much. Thank you, Ursula, for asking me to do this. I will now stop sharing my screen and am open for questions.
So Lamont, I'll ask a question. You mentioned, we are creating the facility here in Lincoln County. We've talked to people who live here who have had to go as far as Hermiston, 300 miles away, for their inpatient treatment. So having it here is going to be, incredible for our community. When you do assessments, hello, Doctor. I'm just going to interrupt myself. Hello, Dr. Mullins. I welcomed you earlier. I'm not sure if you were on when I did that, but it's great to see you here. You're muted.
Okay, well, I figured out finally how to get the video going, but not the other. But now I've got both. So yeah, I enjoyed the presentation. Thank you for remembering me. So I'll leave it at that.
Absolutely. So my question is then, Lamont, when you do assessments, when somebody comes to you and is seeking treatment, what is it that determines they should have the residential treatment as opposed to outpatient treatment?
So in those 6 dimensions, there's different risk levels assigned to those. And so there's a crosswalk, and I can find it and send it to you for reference. But so there's a crosswalk that we use. And so in that crosswalk, it'll say, like, for dimension 1, they haven't used for 7 days. Then that means they meet criteria for level 0 or level 1 outpatient. Then in dimension 2, the crosswalk may say they meet criteria for a level 3.5 residential. And so then we go and look. So in order for someone to meet full criteria to do a level 1 outpatient group, they have to meet level 1 criteria in all 6 of the 6 dimensions. If they meet 2.1 in at least 3 dimensions, and one of those dimensions being either recovery environment, continued use potential, or withdrawal, then they meet criteria for intensive outpatient. And if they meet criteria for 3.5 is what we offer here, but 3.1 or higher in all 3 of those dimensions, then they automatically go to residential. If it's 2 out of those 3 dimensions and 1 other dimension, then they assess as needing residential treatment.
Thank you. All right, so I have another question. If anybody else has questions, go ahead and type them in the chat or raise your hand. But I have another question. So I've been watching the series Dope Sick on Hulu, and it's really been an eye-opener regarding the opioid crisis. You've been doing this work for 15 years, so you've seen, you have a history of seeing when it all first started and where it is now. Can you just talk a little bit about that continuum and what you're seeing, how it's changed over time?
I could do my best. I mean, to be completely honest, I don't know that it's really changed much. There's more of a focus, right? There's more of a focus on it. But, let's talk a little bit about the fentanyl crisis right now, right? So, yeah, we look at the prescription opioid crisis, and, yeah, we've made some progress in some areas there. But then, we still have the fentanyl crisis now. So I think for me, the the most encouraging part about that is it appears as though we're actually learning something from this. We're actually looking at those things now instead of, when I first got in the field and all these things would start to happen, right? First it was the meth crisis, and meth was the big one, and then it went to opiates, and now it's fentanyl, but it used to be like, oh yeah, we have this methamphetamine crisis. Well, we'll just keep providing services, but we're not going to go out in the community. We're not going to do education. We're not going to try to change that stuff. And now the big focus is, let's get out in the community. Let's educate the community, right? What do you need to be looking for? The biggest thing that I hear from my friends in recovery is fentanyl really that deadly? And it's like, yeah, absolutely it is. There was it was either a video or something where it showed just like the tiniest little speck of fentanyl, and that's enough to kill someone. And, most people in the community are just like, yeah, whatever. So us as professionals, in my opinion, and part of my passion is it's my job to then educate the community around, yes, this is a real thing, right? Maybe it's not happening in your community. Maybe it's not happening directly in your neighborhood. And if you are a person whose family has never been touched by addiction, whether it's opioid crisis or another addiction, count yourself lucky, because the majority of families in the U.S. today that are affected from some type of substance use is greater than it ever has been. Does that kind of help answer your question? I don't know. I don't know if it does.
Yeah, it does. I mean, just interesting that even though there's a lot less prescribing going on, that it's still such a major issue because people are getting it illegally. And then, as you said, the counterfeit fentanyl that's in these pills people are buying their overdoses are fatal. The last number I heard in Lincoln County since the beginning of this year, we had 10 fatal overdoses because of fentanyl. So it's definitely an issue. Oh, good. I see Kelly has a question. Go ahead, Kelly. Unmute yourself.
Hi, thank you. So my name is Kelly, and I'm in recovery. I recently opened a practice here in Corvallis to support those who want to get sober or for aftercare. I want to ask Lamont a question. When I first wanted to get sober over 4 years ago, I called and made an appointment with a place such as yours. Took great courage, took immense humility. And I drove 2 hours to this facility. And there was a sign on the door, kind of like, go here or something. It was not welcoming. So my question for you is, if a patient were to come to your facility, what would that look like for them? Can you give us an idea of how welcoming and how easy it is to find? Because as you know, it's so painful to admit that you have a problem and then to actually go through with going somewhere to get help. Can you walk us through that, please?
Absolutely. So we are probably the newest building on our block and signs and stuff, so pretty easy to find us. And then as soon as they walk through the door, our office specialist is the first person to greet them very gently, welcome, we're glad that you're here. We still have to go through the COVID screening process, but extremely welcoming. We're so glad you're here. Okay, so your appointment today is with Charlie. Give Charlie a call. Charlie comes out, shakes their hand, gives them a business card. We are so very thankful that you made it. We are so glad you're here. We do everything we can to kind of help ease them into hopefully feeling a little bit more comfortable. Never a comfortable position, answering a bunch of questions for an hour and a half to 2 hours. But we really strive really hard to just welcome them. All of my staff, myself included, we pass a patient in the hallway as they're going to their appointment or something, and we go out of our way to introduce ourselves. Hi, my name is Lamont. I'm the director here. What's your first name? We get their first name. Hey, Joe, I'm so glad you're here. If there's ever anything we can do to be supportive, please let us know. We're here for you, right? And that's the key. in my opinion, in my experience, right? If someone would have told me that, the first treatment center that I went to, maybe I would have only had to go to one treatment center instead of 4. But that wasn't my experience in the beginning either, right? It was very unwelcoming and cold the first couple appointments I had. So, you know, we got art that was donated, so it's a welcoming, calming environment. We have dimmer switches in most of our offices, so if someone comes in with light sensitivity, we can accommodate that, and just everything that we can do to put them at ease, welcome them, and let them know you're not alone, right? We're here for you, and you know, you're not alone. You're here. Good job, you got here. Maybe it's the first time they've ever heard good job, right? Way to go, congratulations. So that's what we're doing here to try to put the patients at ease and hopefully feel comfortable to sit down and answer some questions.
Dr. Mullins, you have a question? And be sure to unmute yourself.
Yeah, as soon as I figure out the mechanics here. So, yeah, I had a question about staffing. I know it was always a challenge to get enough staff available, and I'm sure with COVID that only accentuated the issue. So that's what I wanted to hear a little bit about is how's the staffing going? Do you have adequate staff? Do we have a good pipeline in place to make sure that there's enough personnel to handle the demand?
So currently, we are much better off staffing-wise than we have been for probably a little over 2 years. We have a couple positions that are vacant, but not very many. We have 3, I believe, that are vacant currently right now, and 1 that we have a start date for a new person into this month, and the other 2 we are actively doing interviews for. So much better off staffing-wise than we ever have been. As far as a good pipeline for staffing, our biggest struggle right now is we need for the patients who identify as male, we need a counselor to backfill the position that I vacated for residential when I was promoted to this position, and we're having a hard time just getting applicants. So don't know if that's from the pandemic, that people are just, you know, comfortable where they're at and they don't want to make a change for fear of whether it will be, you know, secure or long-term or not. But yeah, we're thankful that our staffing issues are less than they used to be, and hopeful that we'll continue to be able to fill those positions and look at more creative ways to make sure when positions do become vacant that we have a better pipeline for new recruits, new stars, so to speak.
Thank you. Kelly, did you have another question, or was that just a raised hand flash?
Yes, I do. I have one more question, please.
Go ahead.
I'm just curious. I believe 3 years ago, as Oregonians, we passed Measure 110. I wanted to ask you, as an organization, how have those funds been accessed? Can you speak to that at all? Thank you.
The funds have been accessed. We have received some funds from that. We currently have the new staff person that we have currently hired, who starts on the 23rd, is actually a peer support for the 110 grant. What we have noticed so far, and I'm hopeful that by having a full-time peer support for that grant, that we will see an increase in this. But STARS as a program itself has not received any direct 110 referrals. But my intake specialist has gone around to some of the local clinics in the community and starting to put flyers and business cards and connecting with some of their leadership staff and providers, etc., to let them know who we are, where we are, how we can assist with that. And so, yeah, that's where we're at with that. We are accessing the funds, but probably not as much as we could if we had more referrals.
Okay, does anybody else have questions? All right, well, seeing none, I'd like to thank you all for spending this hour with us to learn more about Samaritan Treatment and Recovery Services and the issue of substance use disorder. Lamont did include his email in the chat if you reach out and get more information. And I also included my email in the chat if you would like more information about the Coastal Stars facility here on the coast. And with that, thank you all and have a wonderful day.